And I am honored to introduce today's guest, Ibrahim Faltas, the General Director of the Jerusalem Princess Basma Centre for Children with Disabilities. Ibrahim has been leading Princess Basma since 2013, and I think it's fair to say that during his tenure, Princess Basma has been transformed it is now the leading provider of rehabilitation services and education for children and young people with disabilities in Palestine. Princess Basma is recognized throughout the Middle East as a progressive world-class leader in its field. And the center is dedicated to ensuring that Palestinian children with disabilities have access to quality health services and inclusive education. Ibrahim has had a distinguished career in development, advocacy, and policy, with a special focus always on children. Prior to joining Princess Basma Centre, Ibrahim had senior level roles with Save the Children International and Save the Children Sweden in the regional office for the Middle East and North Africa. Ibrahim has a bachelor's degree in international politics and a master's in comparative political science from the Institute of Political Studies in Aix-en-Provence. And he also holds an MBA from Glasgow University. So I'm delighted to welcome Ibrahim Faltas. And Ibrahim, I wonder if you could start by just telling us a bit about yourself, your growing up and your life in Jerusalem. Thank you and welcome.
Thank you so much for having me. Thank you for giving your time to our organization. I was born in Jerusalem. I lived all my life in Jerusalem. My parents were born in the old city and they lived in the old city. Once they got married, they lived outside the old city, but our life was always around the old city. I'm married to the Archbishop's middle daughter. She works in development. She works for the United Kingdom Department for International Development. She's more hardworking than I am. I studied abroad, but my life was always in Jerusalem. Yeah, it's me. This is Ibrahim. And I'm half Armenian. My mother is Armenian.
Great. Thank you, Ibrahim. I know that everybody would like to hear, before we get to the specifics around Princess Basma and how Princess Basma is coping with the pandemic, I know that people would like to hear just how Jerusalem and the West Bank are doing, how they're coping with the virus. And if you could just tell us a little bit of the impact, both the medical impact in Jerusalem and the West Bank and Gaza for that also, and the economic impact of the pandemic. I think that'd be a great place to start.
Since the beginning of the pandemic, Israel and the Palestinian Authority closed very early. They closed by mid-March, and surprisingly, both parties were coordinating at the same time all the actions. The Palestinians were the first to do a quarantine, a lockdown before the Israelis, and to that, in the Palestinian areas, there weren't a lot of infections. There was only one person that died and a small number of people infected. But it was a very strict lockdown. The same was in Israel. It continued for 1.5 months till end of April. And then the Israelis and the Palestinians had no choice but to start to ease a little bit, because it was the economy was going very bad. The rate of employment in Israel reached 26%, the unemployment 26%. So they started to ease the restrictions of social distancing and movement on both sides. The numbers were small compared to the US or to other countries, but the impact economically was huge. The impact was huge on our organization and on the whole economy. And for the moment, it's almost an ease of all restrictions in both the Palestinian areas and in Israel. But now the problem is that the number of infections is increasing. So we are having more and more numbers of people catching the disease. And if this is going to increase, then most probably there will be, again, a lockdown, both in the Palestinian areas and in Israel.
Ibrahim, were there particular communities or populations that were more affected than others from the medical perspective?
Well, so far not, because it was the spread was not like the volume that you saw in Italy or in Spain or currently in the UK or currently in the US. So it didn't really reach. But our expectation is that maybe in September, they say, that there will be this big outbreak, much bigger than what we had. I am sure then there will be populations that will be more affected than others because they don't access the same services like others. For example, Gaza, for the moment, they are fine because in any case, they live in quarantine. They have been living in quarantine for a few years now. But if it goes inside, it's going to be catastrophic. And if it goes also through the West Bank, it is going to be catastrophic because the Palestinian health system is not ready for this. The Israeli is more well prepared. But in any case, it is going to spill over, you know. Even if there will be a big outbreak in the Palestinian areas, it is going to spill over in Israel. Although for the moment, the infections are coming from Israel into, like the Palestinians that are infected in West Bank, they have been working in Israeli factories.
So was there a high level of compliance with the restrictions? Did most people comply?
At the beginning, yes. And the authorities were very strict and people complied. There was a little bit of a problem in the Hasidic populations in Israel, where they did not completely understand what's going on. And so the rate of infection was more higher than in the secular areas in Israel. But now it's a reverse. Now in yesterday's data show that secular areas have more infections than Hasidic areas because ultra-Orthodox Jews, you know, they had no choice but to be strict with their behaviors.
Yeah.
But you know, it's so long there is no cure for this or a vaccine, it is going to move and it will have its own momentum, and it's going to come back. It will come back, unfortunately.
Yeah. And in terms of the economic impact of the lockdown, I know that, of course, the tourism industry, which is important to Jerusalem, has come to a halt. But talk a little bit about the economic impact. And then that might be a good way to kind of lead into Princess Basma and the impact it's had particularly on your organization.
Yeah, so, you know, mid-March, the Israelis and the Palestinians started to put restrictions on the activity of the economy. So they started to shut down sectors, basically. And it's, of course, the tourist industry and the hotel industry has been affected. And there are other sectors that are dependent, you know, even regular shops, souvenir shops, we depend on tourism. And so now in Jerusalem, for example, a lot of Palestinians are unemployed because they cannot work. Even when the companies and all the other services returned back, they didn't return back 100%. So they started also to lose part of their employees. It's hitting almost everywhere. I mean, even in the private sector, people now, if they have money, they are afraid to go buy a new TV because they don't know what will happen in 6 months. So it's affecting everywhere. The only sector that is not that will grow is the sector of either health or the sector of disinfectants for the moment. But everything is I mean, it's not collapsing entirely, but there is going to be a big crunch in the economy, and a lot of people will go poor. 26% went unemployed in Israel. There aren't any data in the Palestinian areas. The only data that went out of the World Bank is that the Palestinian economy is going to get a crunch by 11%. So I know a lot of people that are unemployed, friends. Everything is dependent. And so it affected also the Princess Basma Centre, because first of all, the rehab center, we had to close down entirely on the 19th of March because we couldn't provide services. People couldn't move, and we were not supposed to be open by the authorities. So we closed down from the 19th of March in the rehab center until the 3rd of May. So it was a month and a half that we were closed down, and we had no choice. Only emergency hospital, you know, like we are a member of the East Jerusalem Hospital Network, and the other hospitals, they only received emergency. So everybody, we didn't have any patients.
Hey, Ibrahim, can I just interrupt for a sec? So for some of the people who are on the call who may not know about the range of services that Princess Basma provides, could you just really briefly talk about the kind of main service categories and then maybe talk about the impact on each one of those?
Yeah. So we run a rehab center. We are one of the big 4 national rehab centers in the Palestinian areas. We are among the 4 the most focused on children. We treat around 1,300 cases a year. Some are outpatient and some are inpatient. Inpatient is mainly for children from West Bank and Gaza because they cannot reach us every day for treatment. So we have a special program. It's an intensive 2 to 3 week program where the members of the family take part of that, mainly the mother, and we do intensive therapy to the children. So in the rehab center, we treat around 450 children a year from West Bank, Gaza, and the remaining are from Jerusalem. We run an inclusive school. It's a very unique one because it's 1/3 with disabilities with special needs and 2/3 without special needs, and they learn the regular curriculum. So we have this year 450 students. Among them, 176 are children with disabilities, mainly physical disabilities, but also hearing impaired, and we have a lot of children with autism. And we have been taking a good lead in this field, where we have children with autism that study in the regular schooling. We do a lot of other things. We do a lot of trainings for practitioners. We have university students that the future therapists come and train at the center. We do a lot of capacity building to daycare centers in the West Bank. So mainly we provide services, we build capacities, we share resources, we raise awareness, and since COVID-19, we went into everybody, the whole world, entered into a new difficult situation where we had to close down. So now we're back. Beginning April, we started to come back again. End of April, sorry, beginning May. So the school is back, the rehab center is back. We only treat outpatients, but then not all children outpatient, which is mainly from Jerusalem. And so children, they do sessions at our center, but we do also virtual therapy. So since the beginning, because we had to continue providing therapies to the children, so we did a pilot and we started to use online technology like Zoom and Messenger and mobile phones and iPads, and we continued treatments to children, and we provided over the last 2 months or the first 2 months a treatment to 50 children who were at our center from West Bank, but we couldn't continue treatment, so we did it through video conferencing. It was very useful because at the center, mothers participate in the Mother Empowerment Program, where they basically learn how to become shadow therapists, among other things. So basically, the mothers and the fathers were put at the test because they had to answer the phone call and they had to do the therapy to the children under the supervision of the therapist. And so we developed this, and then now in Jerusalem, it's an agreement with the Israeli healthcare. We provide these services to children, and they want us to continue combined virtual care or therapy, as we call it, and frontal.
So Ibrahim, so even going forward, once the once things open up, you envision seeing continuing with a blended delivery model, some online and some in person?
We have no choice, and this is in all sectors, even in education. So the plan now, I mean, now we had to invent some of the services we do because it's difficult to move around. We have an outreach program. We visit the field 60 times a year. And we visit a lot of daycare centers. We see a lot of children. We refer them to the center, so we have to do it differently. The children that we bring to the center also, now we're going to get them back. We had to do some renovations because our dormitory had joint. I mean, there was more than one patient in the same room, and more than one patient uses the same washrooms. So we had to do minor renovations in order to separate them, in order to prevent infection. So our view is that they are going to be treated at the center, but we're going to minimize their stay at the center. So it's going to be, as you said, it's a combined methodology where the beginning of the service starts at the center, but then it continues at home. And we have no other choice until there is a solution to this pandemic.
Yeah.
Ibrahim,
what's been the impact on employment at Princess Basma Centre? Have you been able to keep staff? Have you laid people off and furloughed people?
So, what happened is that mid-March or almost 19th of March, we had to close down. So you close down, you don't treat children. So there is no income coming from the Israeli medical funds or the Palestinian Ministry of Health. And although even, the Ministry of Health, Palestinian Ministry of Health only pays a portion to the cost. But they were not referring children. And so we started to calculate. We did our own internal calculations, and we planned scenarios. And so first of all, based on the new scenario, we had to restructure based on the new scenario where we do not expect that we're going to receive the same number of children from the Palestinian Authority for treatment. We expect we will get 2/3 of them, or 70% of what we used to receive, because the Palestinian Authority is collapsing. Palestinian Authority doesn't have any more money. They owe us almost $1 million now, and they cannot pay us. So they pay us every few months, a few $100,000, a couple of $100,000. So, we expect that, there will be a need. Children will need treatment, but then the Palestinian Authority will not be able to pay for them. They will refer them to us, but they will not be able to pay at all. I mean, they will say we owe you, but this might, continue for 5 years or something.
Yeah.
So we are worried about this, and also we are worried about what we expect the cycles of outbreaks that are going to take place. This is until World Health Organization tells us otherwise. The way it looks is going to be at least another big outbreak. So we have to work around that also. How it affected us is that we calculated what will be our new income, or already what we are having now. And so unfortunately we are going to reach, we already started doing cuts in all departments, in the school and in the rehab center and in our sheltered workshop. And we are going to reach by the end of this month a cut by 25 staff. And then we used to be 134 staff. We're going to be 107. But I can check the right numbers.
Yeah.
But we will become 107, and then 31 staff members are going to have their contracts changed to, part-time, because that's it. There is a crunch in the income, and also our calculation is based also that we generate 70% of our income, 75%. So 25% is dependent on fundraising, and this has been like this for always. The disability sector is never subsidized 100%. So we also are anticipating that there will be a decrease in the funding coming from donations. So we got hit, but at the same time we managed to maintain the services, although we're going to treat less children from West Bank Gaza. Our school is maintained, but there were cuts in the school. Of course, the school has started online teaching, is going to continue to do that, because the instructions now from the Ministry of Education are you have to do combined. We have no choice. It's up to you. If you have a coronavirus incident, close down for 2 weeks, then open again. So we need to live with this. So it's going to be children in and out, and we're trying to collaborate with another organization so that we develop more our online teaching. But it affected us.
Yeah.
We're saying goodbye to people that have served well this organization.
It's a very difficult situation, really difficult. And you think of in many ways, Princess Basma is unique and really the only place families have to turn to for these kind of services. So you think of the impact on families and children all over the West Bank and Jerusalem and Gaza, and it's tragic. But thank you, Ibrahim, for that overview and insight into the Middle East and how things are going in Jerusalem and your incredible organization. So I think we have time for another question, or maybe two. Anyone else have a question for Ibrahim?
Ibrahim, hello. I'm Holly. I'm a new Holly Boone in Seattle. I'm a new board member. Recently in the New York Times, there was the article about the Palestinian Authority simply stopping doing a lot of the services that they normally do, such as, I think, policing and security, with the intent that Israel is going to have to adopt those duties. How is this playing out? I mean, you mentioned Palestinian Authority is possibly going to disintegrate, but what about this specific attitude or this new ploy that they have to this new strategy that they have concerning Israel and the whole annexation debacle thing here? I'm sorry if I didn't state that very well, but I think everybody knows what I'm talking about.
So absolutely, it's to reiterate on what you said, it's basically President Trump agreed with the Israelis on the deal of the century. It's the new peace plan that contradicts the Oslo agreement plan on how they will reach peace. So Trump, you know him, so he did also that, and he, with the Israelis, he decided that they are going to take big chunks of the West Bank basically and hand it over to the Israelis. And so the Israelis now, they want to implement the plan unilaterally. So they are planning to annex around, I'm not sure of the number, but it's almost 40% of the West Bank. But you need to check the number. But it's a big chunk. But basically, they are in control of everything, the Israelis. It's not that they are going to go in and take it. They already own it. They're just on paper. They are going to say it's not occupied land. It is Israel now. And so the Palestinians are so angry. And so they are trying to, I mean, in any case, the Israelis are putting all the time a lot of pressure on them. So money that needs to come into the Palestinian Authority, they hold it back. Money from customs, money that they need to get, it's their own. So Israel withholds and uses it as pressure on them. And the Palestinian and Israel lobbied other countries to do the same, especially the US, and the whole cut in the US money to the Palestinian Authority. Because the whole agreement between the Palestinians and the Israelis and the Oslo agreement was with the guarantee that the Americans are going to put in money into this. And so they are taking money from the Palestinian Authority and they are putting it in the corner. They are putting so they have nothing. They don't have money anymore. And we see it because they don't pay our money. They don't, and then they have no other choice. And if the Israelis are doing this, so the new strategy the last 2 weeks is that they said we're going to stop coordinating security with the Israelis. Because according to the Oslo agreement, the Palestinians need to take care of security, in the Palestinian areas. I mean, the Oslo agreement turned into creating a Palestinian Authority that is in charge of policing, sewage, roads, education, and health, and nothing else. And so the Palestinians have nothing, they don't have any money to continue. And because Israel is going to also to take all that land that is supposed to be for the Palestinians, they said, we're going to stop coordinating with you. We're going to stop speaking to you. But it's affecting, for example, the patients that come to the East Jerusalem hospitals, like us. So what's happening is that the patients are going to so if a patient needs to come to one of the hospitals in Jerusalem, including us, has to go to the Palestinian office, where they submit their papers. That this Palestinian office is merely administrative. They need to take it to the Israelis, and the Israelis will issue the permit to enter into Jerusalem, and they will give it back to the Palestinian administration to give it to the patient. So the Palestinian Authority, they became an intermediate between the occupation basically and the patients. So the Palestinian, I won't stay long. I do not want to continue long, but what they do now, the Palestinian side, is that they take the applications and they put them in the drawer and they don't send it to the Israelis because they said they're not going to do this. So now slowly patients are not coming to us. So what we did is that we tell patients, don't go to the Palestinian intermediate, go to the Israelis, because the Israelis also have offices. You can go directly to them. So this is what we're doing, and on Sunday, hopefully, we're going to start. We're going to get patients, and we're going to get our first 4 inpatients since almost 3 months, almost. And so this is a challenge. This is a challenge, Holly, and we don't know what will happen. But it's crazy. Everything is crazy now. And yeah.
Thank you, Ibrahim. And Holly, thanks for that question. I'd love to go on, but I want to honor people's time. But I think that was an appropriate question to end on. It just puts things in context. And I think we can all appreciate the incredibly challenging conditions you're operating under, Ibrahim. They go above and beyond the challenges of the pandemic. So I think I can speak for everyone here. Our hearts are with you. Our prayers are with you, and you and your staff and the people that you serve. We wish you nothing but the best, and it's really an honor to be able to spend some time with you and hear about the truly life-changing, life-saving work that you're doing in Jerusalem. So thank you very, very much. And thanks to everyone for joining us. We'll have more of these events. We'll keep you posted on them with other distinguished leaders, and we hope to see you in this funny little chat room again. So thank you all very, very much.